My name is Anitha John. I'm the head of the Washington Adult Congenital Heart Program that was established about 10 years ago to address the needs of the congenital heart population because there is now an over 90% survival rate. And so all of the children that we are taking care of now are surviving well into adulthood, except their hearts remain quite unique, and so they need specialized providers and teams to be able to give them recommendations about their health care and their cardiac health. I guess I sort of stumbled along into the field of adult congenital cardiology. I took sort of a unique training path. And while I was starting out medical school, I got very involved in one of our research laboratories, and I did 3 years of bench research. Congenital heart disease is a really heterogeneous group of conditions, so there are lots and lots of different types of congenital heart defects. So one of the challenges of being a congenital heart specialist is sort of being able to adapt for each individual patient and understanding what the basics are behind the disease process, but also understanding that each patient is unique and can have their own set of complications. So patients who have adult congenital heart disease, they can be monitored in sort of different ways depending on the complexity of their heart disease. Many of these patients need cardiac MRIs, and that's a more advanced way of being able to image their heart, and we offer all of those services here with cardiac MRI doctors who are actually specialized in really only looking at patients who have had problems with their heart or being born with heart defects. So we do a lot in our program really to be able to identify those patients who are at risk, and we also utilize the expertise of other adult subspecialists to be able to help with the other organ systems that might be affected. So I think our program is unique in that we're not only able to provide comprehensive care, but we also help other providers with being able to obtain that for their patients. And I like to think our program is very patient-centric because of that.